Hello, everyone. Thank you for joining us today. This is the IUCN Commission on Ecosystem Management webinar on nature and mental health. Today, we will have a 90-minute session where we will hear from 3 presenters and have a rich conversation of questions and answers on this important topic. My name is Liz Willits. I am a coordinator for the IUCN Commission Working Group on Ecosystems and Human Health. For those of you who do not know, IUCN is a large member organization of conservation organizations worldwide with 1,400 members. The organization has a hand in global policy circles and a foot in the soil of ecosystems around the world. This working group is a committed group of scholars finding a way to build capacity for better knowledge, understanding, and scholarship on the environment and its role in our lives. Today, we will hear from Melissa Marcel, a leading scholar in the biodiversity and health field. She is an expert in nature and mental health, an environmental psychologist. Her interests include the psychological process of sustainable behavior and behavior change, and the focus on the mental health benefits of biodiversity, among many other things. We will then hear from Sherp de Vries, a deeply experienced researcher and environmental psychologist who has spent years working alongside the public sector. He is based at the Wageningen Environmental Research in the Netherlands. He conducts quantitative research on cultural ecosystem services, including outdoor recreation, landscape appreciation, and especially on the effect of contact with nature and human well-being. He has authored many well-known pieces, including for the World Health Organization on green space, and has contributed to large systematic reviews. We will then hear from Monica Lopez-McGee, the Vice President of the Children and Nature Network. Monica is the Senior Vice President. She helps city and community leaders develop programs, policies, and partnerships to provide children and families access to nature and its many health and academic benefits. She's a recent National Collaborative for Health Equity Fellow and draws on her master's degree in public leadership and undergraduate studies in environmental science, a decade facilitating youth and family programs in urban settings, and her cultural heritage to create nature-based solutions that prioritize communities of color, transform public spaces, and foster love and stewardship of the natural world. We are really excited to have this trio of presenters today. We will also be hearing from Siti Hafsia Idris, who is the co-moderator for this session and will join us for the Q&A portion. Siti, I welcome you to introduce yourself before we get started.
Thank you, Liz, for the introductions. I'm the Associate Professor in Environmental Law from University Technology Mara, Malaysia, and my focus research is actually on eco-anxiety, as well as on plastic pollution and also biosafety. So on eco-anxiety, we have started a research with the University of Sussex on the legal perspective and legal framework on the eco-anxiety. So we merge the idea of how the law look into the effects of climate change and environments towards mental health. So that is actually one of the discussion that we hope can be addressed in this webinar. So thank you so much, Liz. I give it back to you. Liz, you are muted.
Thank you. Before we get to the presentations, I just wanted to provide a little bit of context for this topic, which is an emerging field as well as an emerging policy space in local, national, regional, and global scales. To draw some attention to why this issue matters, nature and mental health, we had 167 registrants to this meeting from over 30 different countries. And the attendees are ranging from United Nations officials to camp counselors, zookeepers, the Ministry of Health, grade school teachers, doctors, business leaders, and veterinarians. So that we have a common bond on this topic. This is an issue that is broadly of interest to many diverse professionals. We also have a problem in that there are signs all around us that our stewardship is poor. Our stewardship of the planet is poor, and it has become subconsciously and consciously stressful. One of the telling indicators is that now we have new words to describe the phenomenon of interacting with environmental degradation. And one of those terms Siti mentioned is eco-anxiety. Another term is solastalgia. These are terms that express like how large-scale environmental change is causing distress and depression or other negative mental and emotional conditions. These are new. There's a great interest in thinking through these terms. They're the field of study that we need to develop to address them, as well as just broader stewardship and how we regain a connection with the environment that many of us can recognize is important. And to that point, the connection between communities and their environments is actually enshrined in many constitutions of many countries worldwide. It's also enshrined in cultural traditions, in religious texts, but many of our policies don't reflect this when they're being implemented or designed. There are opportunities this year in 2024, including in major global forums for addressing the environment and health, and one of those is going to be taking place just this next week at the United Nations Environment Assembly, and the other is at the Convention on Biological Diversity, which is a global forum for making decisions on the environment really quite broadly. The Convention on Biological Diversity has an open action plan on biodiversity and health and hopes to adopt this plan by the end of the year. So this webinar sits in the context that there is real policy momentum to consider how we might take issues of biodiversity and health, issues of nature and mental health forward. And our speakers today will speak about the top-down and bottom-up approaches to integrating environment and health. Both are essential to making good decisions and to implementing them. And we're really excited to have this expertise and provide a stage for it. So with that, I will just offer a few housekeeping. Please put your questions in the chat. We will field all questions and coordinate a Q&A at the end of the third presentation, and really look forward to having you be part of this group. So Melissa, please, I welcome you to start us off with your presentation. Paula, you can begin the presentation. And Melissa, we had discussed how interesting it is that there is a field now of environmental psychology. So as part of your presentation, we look forward to hearing about what that is and what this field is about, and your experience with what is a conceptual framework for biodiversity and health. How do we even put these ideas together? So over to you.
Thank you very much, Liz. Yeah, I'm an environmental psychologist, which means that I investigate how we perceive and experience environments, both built and natural, and how they have an influence on us. So in a way, environmental psychology puts an environmental perspective and broadens the perspective of psychology. So thank you for your time. Next slide, please. As we all know, biodiversity is essential for our human health and well-being. We are fundamentally dependent on nature for our health and well-being, for the water that we drink, the food that we eat, and the air we breathe. Next slide, please. Thank you. However, biodiversity, the diversity of genes, species, and ecosystems is declining at an unprecedented rate, and climate change is only accelerating this loss. And in this way, biodiversity loss is a huge risk to human health and well-being. So this means that the loss of biodiversity is not just an environmental concern, but becomes a public health concern as well. Please, next slide. And in this context, we have two reports that came out quite recently, both looking at the economics of biodiversity, or the values of biodiversity. The UK government's report on the economics of biodiversity states that our economies, our livelihoods, and our well-being are all dependent on our most precious asset, which is nature. And in the IPBES, that's the Intergovernmental Panel for Biodiversity and Ecosystem Services, in their values assessment, they highlight that this conceptualization of nature as an asset has led generally to one value of nature, which is a non-market value, or sorry, a market value, looking at, you know, nature as a product from which we can gain short-term profits. But the IPBES values assessment tries to highlight the other non-market values associated with nature's contributions to people, such as nature's ability to improve mental health and well-being, and even calls this a relational value. Next slide, please. So my talk here is not going to be about eco-anxiety and the negative consequences of biodiversity loss, but the health promoting benefits of contact with biodiversity largely. Additionally, in policy context, we have work done to link biodiversity and health by the Convention for Biological Diversity and the World Health Organization in 2015, in connecting these global priorities between human health and biodiversity. And then very recently, you have IPBES doing a nexus assessment, looking at the interlinkages between biodiversity, climate change, human health, and food and water. Please, next slide. And the next one, please. So how can the relationships between biodiversity and human health be explained? In order to link the nature conservation and public health agendas, we need to have a better understanding about exactly how biodiversity has an impact for human health. And to answer this question, we need to unpack the causal mechanisms that link biodiversity to human health. So this is what we call the black box in medical sciences, these mechanistic pathways to understand how one thing relates to another. And I'm going to discuss the conceptual framework that was developed in 2021. But before that, I'm going to go through why we needed to develop this conceptual framework in the next slides, please. And the first is the IPBES framework on how nature's contribution to people influences our quality of life. Now, IPBES, this framework was designed to serve a broad range of functions and audiences to guide policy development. And for that reason, it's unhelpful to really understand how biodiversity or nature influences health and well-being, in that here, physical, mental, and emotional health are just one of the outcomes of many for quality of life. And so this doesn't help to identify the specific pathways through which what contributions from nature impact mental health and well-being. Next slide. And then the World Health Organization in 2021 had another go, following on from their 2015 report, on understanding the linkages between nature, biodiversity, and human health. They do better in that health is at the center now, and they have a few of the mechanisms that everyone can easily understand on how nature and biodiversity can influence human health, like medicines or infectious diseases. But there are aspects of this model that are a bit confusing, like access to nature. What this pathway, it's unclear what's in this pathway, and that there could be multiple different ways that access to nature can influence human health. So next slide, please. So in contrast, as a psychologist, I look to frameworks from the area of psychology and in public health and the medical sciences. And this is a framework model by Ayana Markovich and colleagues, one of which is Sherp DeVries, that was published in 2017, that looks about how green space indirectly influences health and well-being via 3 pathway domains of reducing harm, which is about green space's ability to mitigate stress exposures, or green space's ability to restore capacities, or green space's ability to help build our capacities for dealing with future stressors. But it was unclear whether this model could be applied to biodiversity. So next slide, please. And the next one. And so there was a need for a causal framework that clearly describes the various ways that biodiversity influences human health. And in September 2019, Professor Aletta Bond and myself led a synthesis meeting with a group of 24 international experts, one of which is Sherp DeVries in the bottom left hand of this photo, looking at exactly how can we understand the different connections that link biodiversity to human health. And click, this work was published in Environment International in 2021. Next slide, please. So this framework builds on evidence from the natural, social, and health sciences, from me and 20 other interdisciplinary experts. And the model states that biodiversity indirectly affects human health and well-being via 4 domains of pathways, both beneficial and harmful. So these domains of pathways are similar to the one I showed from Markovich et al. 2017, in that biodiversity and contact with biodiversity influence health and well-being via reducing harm, restoring capacities, building capacities, and causing harm. And I'm going to go through the aspects of this model very quick. Next slide, please. So I'm going to start with the biodiversity box. Next slide. And in this model, biodiversity can be measured as both actual biodiversity, so the number of species or individuals present in a location that usually ecologists use, but you can also measure biodiversity through this perception of biodiversity. It's a proxy measure, which is a person's subjective assessment of the biodiversity that they think is present in an environment. Next slide, please. And in fact, studies show that perceived biodiversity measures can have stronger correlations with well-being than actual biodiversity. And this study by Cameron et al. 2020 shows that respondents report being happier in sites with greater actual avian biodiversity, which is the graph on the left, but that these relationships are strengthened when the emotions were connected to people's perceptions of biodiversity. Next slide, please. So the contact with biodiversity is the next step in the framework, and it describes how mostly to get health and well-being benefits, we need to have contact with biodiversity. And there are 2 aspects here, exposure and experience. Next slide, please. Now, exposure discusses the person's amount of contact with biodiversity, and this is usually defined in terms of frequency and duration. This could be thinking about dose. So how, we have a medicine, we take that medicine, for how many times a day and for how long. Next slide, please. Now, the experience aspect of biodiversity refers to how a person experiences and interacts with biodiversity through their 5 senses, and such as seeing, hearing, smelling, touching, and tasting. And that the way that we experience biodiversity can have an impact on these well-beings. Next slide, please. The medium pathways. But we can also experience biodiversity directly or indirectly. And this could be how our physical proximity to it. So if we click, we can be exposed to biodiversity indirectly in that we're not physically present in it, like looking through a window, or click. We can be exposed to biodiversity by being physically present or physically exposed to it, such as going for a walk. And how does that change our experience of it? Next slide, please. Our experience of biodiversity can also be intentional or incidental to another activity. So click. Our experience could be intentional, where we're experiencing the natural environment is fundamental and central to what we want to do, or click. Our experience of nature could be incidental or a byproduct of another activity, such as viewing, enjoying the park with friends. And how do these different ways of experiencing nature have an impact on those mediating pathways and our mental health? So next slide, please. So I have about 3 minutes, so I'm going to go through this really, really fast on the mediating pathways, and they're not going to be discussed in order. Next slide, please. So the
Take an extra minute, Melissa, please.
Okay. Thank you. All right. So the first is the reducing harm pathway, which discusses the ways biodiversity can influence human health and well-being by mitigating or reducing ill health. And these are things like how biodiversity in nature provides us with medicine or food or clean drinking water. The reducing harm domain here is well researched. It's usually the one that we typically think about when we think about how biodiversity influences human health. It's the one that usually gets signposted first, right? Like the link between air pollution and physical health. And for that reason, and because of time constraints, I'm not going to go into an example here. So next slide, please. So the next domain of pathways on how biodiversity can influence human health is via the causing harm pathway, which highlights all the different ways that biodiversity can influence human health and well-being by causing harm, by hurting us. And these are things like having contact with wildlife, such as animals that bite us, or plants that sting and hurt us, infectious disease agents like Lyme disease or coronavirus, microorganisms similarly, or allergenic plants. Again, this causing harm domain of pathways is also well researched, and the causal link of how biodiversity indirectly affects physical health via allergens or infectious diseases or contact with steamy nettles is well known, and we all understand that. And again, with COVID pandemic, it's also something that people often think about. Because of this, and because of the focus being on mental health, I won't go into this pathway today. Next slide, please. So I'm going to talk about the building capacities and restoring capacities pathways. Now, the building capacities pathway refers to the deepening or strengthening of our capacities to meet the demands of everyday life. So this is about how nature can, maybe biodiverse environments can help facilitate physical activity or transcendent experiences, or facilitate social interaction, or place attachment and place identity, and how all of these experiences have an impact on health and well-being. I'm just going to give one example of this in the next slide with transcendent experiences. Next slide, please. So transcendent experiences are things like awe, humility, and self-reflection, and they contribute to well-being. Click. And research shows that the sights and sounds of nature, both mundane and awesome, have been found to elicit these transcendent experiences. Next slide, please. In the area of positive psychology, does a lot of work into the psychological benefits of such transcendent experiences. Now, an example from biodiversity is from 2 studies by Fuller et al. And Dahlemer et al. And they looked at the relationship between biodiversity and self-reflection. And they found that actual species richness of birds and plants in green spaces were positively associated with self-reflection. So an environment that had more diversity in the number of birds and the type of birds, as well as the type of trees, people reported having more reflection about their lives, their thinking about life problems, what's the bigger picture. But interestingly enough, people's perception of the biodiversity in that space was also positively correlated with self-reflection. So if the person perceived that this environment had a greater richness or diversity of birds, butterflies, and flowers, they also reported having more reflection in that environment, to thinking about the bigger picture. Next slide, please. The restoring capacities domain here refers to the recovery of adaptive resources that have been diminished through the demands of dealing with everyday life. And over time, lack of restoring these capacities can lead to mental or physical ill health. And environments that support the restoration of these depleted capacities are called restorative environments. And there are two theories of them: stress recovery theory and attention restoration theory. Next slide, please. And they just basically say that natural environments benefit health and well-being by facilitating recovery from stress, or attention restoration theory says natural environments can help restore our ability to focus or direct attention. And we can just click through to the next slide. Thanks. I'll give one example of this due to time, and that's about a study showing the relationship between biodiversity and reduced stress. Click. So studies show that natural environments reduce physiological measures of stress, such as heart rate. But what about biodiversity? So click. There was an experimental study done by Linda Matthews and Matthews that looked at the relationship between biodiversity and stress, in that they measured people's blood pressure as they looked at meadows of various plant and herb species for 2 minutes, and they measured blood pressure. Click. And they found that blood pressure reduced the most, meaning people were the most relaxed, when people looked at meadows of 32 different species. Click. So this is the intermediate amount of diversity, and that people were least relaxed when they looked at meadows of 64 different species. So click, which are these points here, showing the relationship that exposure to biodiverse environments can have for reducing our stress and making us feel more relaxed. And we'll go through the next slide, and we'll pass through this one. Sorry, there's a few. We just gotta click again and again. Sorry, I didn't know I couldn't control this. The next slide, please. And the next slide after that, we'll just skip over this one. And so we're just, because I'm over time and I'm sorry about that. So how can the biodiversity framework model be beneficial and used for policy and practice? Well, the first is that by demonstrating all the ways that biodiversity can indirectly influence human health, it helps break down this silo thinking of people who work in nature and people who work in health. And it can help foster cross-sectorial dialogue. Click. So this policy frameworks are needed to ensure that both biodiversity and human health are mentioned in both biodiversity conservation policies, as well as public health and city planning policies. The framework can help identify the various pathways, both positive and negative, through which biodiversity influences human health. So in that way, it goes beyond just discussing the usual suspects of food and water or infectious diseases as well. Click. And the framework can help us for understanding this relational value of mental health, in that it starts to discuss it first puts mental health on the map, and then talks about exactly how biodiversity can influence our mental health and well-being. If we go through the next, thank you very much. With regards to practice, click. The framework could be used to help further understand natural environments as a health promotion intervention. And I do believe Monica is going to talk about this later. There's an increased interest in green social prescriptions. This is using where healthcare supports people to engage in nature-based activities. to improve their physical and mental health. And in fact, in the UK, this is largely used just for mostly physical health and well-being, and the government just invested 5.5 million into this. So physicians and public health authorities might consider using prescribing biodiversity-based interventions or prescribing activities in biodiverse rich environments to put people in contact with nature for their mental health and well-being. Next slide, please. It can also help inform natural resource managers in developing and maintaining IUCN urban protected areas to help improve people's mental health and well-being, in that these protected areas are settings perhaps for green social prescriptions, and that they can be, and the framework can help identify and broaden out the co-benefits of nature-based solutions, in that perhaps these nature-based solutions could be public health infrastructure. And thank you very much, and I apologize for going over.
Melissa, that was fantastic. Thank you so much. And I just want to kind of bring this together as you had an incredibly complicated topic and field to convey, and just have a moment of pause on that in trying to put this intrinsic connection between nature, mental health, and well-being into a framework on paper. And why it's complex, because biodiversity is complex. It's complex because health has multiple dimensions and it's experienced differently by cultures all around the world. We need this kind of information because our policies are based on this evidence-based model. We need information that can communicate into a policy and in essence, prove both the market and non-market value of why we need to have more investment on this space. That's very complicated, and we appreciate the effort that you took to explain all of this, and I welcome everyone to read the paper looking at these frameworks. This is one example that's developed over time. There are other parallel frameworks that exist in other communities and scholarship of knowledge, and it really is at the forefront of the field of how we can bring value out of this sort of research. And with that note, I'm really happy to introduce now Sherp de Vries, who spends a great deal of time thinking about this evidence and how we can make evidence more valuable and more applicable. So Sherp, I welcome you and your presentation on the more of the science aspects of how we are putting together the evidence for these frameworks and for implementation.
Thank you, Liz. Thank you for having me here. Well, yes, I would say more on the scientific aspects because Melissa already covered quite some of those aspects, but I hope I can add a couple of new ones. Click, please. It's a list of the topics I'm going to address. First, the evidence regarding associations, then the importance of type of nature, the importance of nearness, difference in access to nature and the sports, and implications for policy. Okay, next, please. For the evidence, I will briefly present some outcomes of a recent IUFO report, International Union of Forest Research Organizations, appeared last year. It was written by a global forest expert panel, and despite the title, it's not only about forests and trees, but also about other types of nature and green space. Click, please. And I'm especially going to talk about chapter 3 that deals with the evidence base. It's written by 25 experts from all over the world, and it's not a systematic review of the evidence, but the experts that we invited mostly were authors of such systematic reviews. Next, please. We did group the evidence by life stage. First, it's for children, from starting with babies. And click, please. For babies, mental health is a pretty complicated thing. It's about pregnancy complication and birth weight, but a little bit older, we have children. And there is quite some evidence that contact with nature has a positive effect on the neurodevelopment and mental health of children. neurodevelopment usually deals with disorders like attention deficit hyperactivity disorder and problematic behavior. Next, please. Then for the adults, we have a whole section on mental health. We have mental well-being, mental disorders, and spiritual well-being. Mental disorders are disorders as diagnosed in one way or another by your family doctor, for example, or by a psychologist, psychiatrist. For that type of health outcome, the evidence is not that strong. And I think that it's partly to do with fewer studies being conducted using that type of health outcome. For mental well-being and quality of life, there's strong evidence about on a beneficial association with nearby nature or contact with nature, and the same is true for spiritual well-being. Yeah, spiritual well-being, you could say, is a part of mental well-being, but it is a little bit more spiritual, more higher level well-being than perhaps ordinary daily well-being, mental well-being. Click, please. And then we have the third stage, life stage, the elderly. And here we see strong evidence with regard to a beneficial association for cognitive decline and dementia, and also for mental health and well-being in general. So all in all, you could say there's pretty strong evidence that nearby nature, contact with nature, is associated with the mental health and well-being of people. But it's not only for mental health and well-being, as you saw in this overview, it's also for physical well-being. And that's why I thought it might be a good idea, click please, to spend a little moment on the interconnection between mental and physical health, because we all know they influence each other. And there's one pathway in particular that might be very interesting with regard to that link between mental health and physical health. And that's the pathway of reducing stress, especially chronic mental stress. And you can also look at it physiological dependent allostatic load, now becoming more popular as an outcome measure. So allostatic load is the physiological consequence of chronic mental stress. And it has been shown that chronic mental stress, allostatic load, that they affect the functioning of our immune system, our resilience, you could say. Click, please. And that might imply that stress reduction by contact with nature could be a central pathway. And with a central pathway, I mean, we have seen that contact with nature is associated with many, many different health outcomes. And we can look for different pathways for each health outcome, or we can try to be a little bit more parsimonious and look at more central pathways that could explain outcomes associations with a range of health outcomes, and stress reduction just might be one such pathway. Okay, then we focus on mental health again. A couple of years ago, I was involved in an Eclipse expert working group. Eclipse is a project financed by the European Union, and they install expert working groups on specific themes. And this was a working group on green and blue spaces and mental health. And Melissa was also involved in this one. And this particular expert working group was also co-financed partially by WHO. And in the end, the outcomes were taken up in the publication written by WHO with us as co-authors, Green and Blue Spaces and Mental Health, New Evidence and Perspectives for Action. But time went by. Click, please. So it was time for an update. And the article that you see now is an update of that earlier inventory, systematic evidence mapping of what is known about which characteristics of nature are especially important with regard to mental health. That was the focus of the exercise. The outcomes may be a little bit disappointing in that, as far as we can tell now, it looks like all types of nature are beneficial associated with mental health. There's not a very clear winner. And besides looking at types of mental health, you can also look at characteristics, but I will tell something about that later on. Next slide, please. Characteristics. One of the characteristics that Melissa also talked about is the biodiversity of the nature. So in this presentation, biodiversity is seen as a characteristic of the nature. So on one hand, you have nature, a forest, and on the other hand, you have the biodiversity within that forest. That's how it's looked upon in this. And for biodiversity, we use the CBD definition, variety among living organisms. Usually in research, it focuses on species richness. And as Melissa also already talked about, there is some evidence that especially perceived biodiversity at species level is associated with higher well-being effects of contact. And mostly it's about research looking at short-term effects, so directly after a visit to a natural area. But why? How does this association come about? Is it the actual biodiversity that's important, or is it really the perceived biodiversity, which would make perceived biodiversity not just a proxy for actual biodiversity, but the variable that's of interest in itself? For perceived biodiversity, it could be that we know that from other research that visible variation makes an area more pleasant to experience, which could mean that people are more likely to visit it, and when they do visit it, the experience might be more positive. Click, please. It can also mean that especially variation between species that are considered attractive, likable, is important. There might be, for example, a big difference between a variation between arable land and agricultural grasslands versus between a variation between forest and heather. Next, please. This is a slightly different framework, but you see some of the same elements as discussed earlier. It starts on the top left, top with existence of nature. What is present in terms of nature where relative to one's location? The next term is familiar: exposure to nature, the amount and of time spent in it, the frequency of visitation. Next one is a little bit new, you could say: engagement with nature. What are you doing there? Are you just viewing at it? Are you gardening? And then we have the experience is influenced by exposure and engagement. And in the end, we have the health impact. Can you click, please, once? So a lot of research looks into the experience of nature, and usually looks then at short-term effects in laboratory experiments or just after a visit to nature. But in a daily situation, it's also very much the exposure to nature can be important. Can you click, please, once? So the exposure to nature, and that's more difficult to investigate in a laboratory context, because you cannot keep people cooped up in the laboratory for long periods of time. So that brings us to the issue of, experience of nature. We saw that there is not a clear winner when it comes to type of nature with regard to mental health, but there might be big differences in how often people are exposed to certain types of nature. Next slide, please. So Melissa already talked about it a little bit, difference between purposeful visits to nature versus casual encounters. Most of us spend very little time in natural environments, but we do encounter natural elements in our built-up environment frequently. For example, the trees in your street, if you have them, and even more perhaps your own garden if it contains greenery. So that's why I came up with this medical analogy. What's more important? What has a greater effect? An occasional shot of high quality nature on the left side, or a constant drip of everyday nature, very ordinary nature, the street trees, the garden, verges, etc. And it's interesting to note that especially during COVID, there have been lots of studies done on just having a view on nature from your living room window and your mental well-being. And those studies show that if you have such a green view from your living room window, your mental well-being is better than if you don't have a green view. So there's something to be said for looking also at the amount of exposure, even if the nature is not very special. Next, please. Next topic, something about individual difference and the importance of contact with nature, especially. Actually, I'm only telling something about socioeconomic positions, difference between people in different socioeconomic positions, or between deprived neighborhoods and wealthy neighborhoods. As you might expect, there are differences in access to nature, in that usually poorer neighborhoods tend to have poorer access to nature, or access to nature of a lower quality in terms, for example, of maintenance. But this article is about how important is that contact for people with a different socioeconomic position. Click, please. And the conclusion of this systematic review is that beneficial association between residential green space and health is stronger among poorer segments of the population. Click, please. Especially so when it comes to public green space. Click, please. And for some reason, the phenomenon is stronger in Europe than in North America. Is there another click? No, next one. And that was a systematic review. I want to highlight one study, a European study, a large-scale European study, looking at several different countries. Can you click, please? And the conclusion of this study is that the socioeconomic inequality in mental health, mental well-being, I'm saying, was 40% narrower among respondents reporting good access to green and recreational areas compared to those reporting poorer access. So this suggests that access, providing people in deprived neighborhoods with good access to nature of at least reasonable quality, you could say, can help to reduce health disparities, socioeconomic health disparities. Next, please. Policy implications. Yes, I was asked to look at a global action plan on biodiversity and health of the CBD. And that draft global action plan states biodiversity is a key environmental determinant of human health. Well, my opinion is that at the local and relatively short-term level, this is questionable. At the long-term and large-scale level, sustainable, healthy, resilient ecosystems are of vital importance. And then we are talking especially about functional biodiversity, biodiversity that's important for the resilience, the health of the ecosystem, which is not always the same than just species counting, which could make a zoo having a very high level of biodiversity. Second one is the amount of nearby nature, or contact with nature is important, perhaps even more so than the specific qualities of that nature. Click, please. And you shouldn't only think of nature as such as urban parks, but also of small natural elements in the built-up area. And that pertains especially to Action T12 on urban areas. So don't think only of green areas, but also think of the small natural elements, and even about private green space in gardens. Finally, policy implication is, I think it's very important now in the Netherlands especially, there's a lot of densification of cities going on, and densification can have some advantages in terms of being able to offer certain facilities, but it can also have negative effects on residents' mental health, I mean also physical health, that are, I think, not recognized sufficiently at the moment. Next, please. Thank you for your attention.
Thank you so much, Chef. That was extremely interesting. And again, emphasizing, highlighting how complicated it is to really dig into not only the dimensions of mental health, which you laid out so clearly, but then the chain of connection. So going all the way from, exposure, as you were saying, to engagement and experience and impact, and how we actually tease those out because we rely on evidence-based frameworks, and how useful this information is, and how challenging when innately we know the answer might be nature is a good thing, but as we try to dig into the evidence, it's really hard to potentially get all of a comprehensive answer, because it's hard to measure exposure, for example. And I really appreciate that you highlighted the equity component of thinking about mental health and thinking about green space, and the idea that, nature is a necessity and not a luxury, and how we think through that. Look forward to asking more questions, and I hope our audience is putting together some good questions in the chat and for later. To bridge, going from Sherp's presentation on evidence, on equity, on science, on multiple dimensions, we're now inviting Monica Lopez-McGee from the Children in Nature Network, and she's going to tackle another difficulty that we have, which is, okay, now we have an understanding that this is a very important space, a very important value. We need to shift and change how our communities and cities and governments are structured on this. How do we do that? And Monica is an expert in this space. We really welcome her presentation. And over to you, Monica.
Thank you, Liz, and good to be here. And, as you named, Sherp and Melissa have covered quite a bit of ground around the research. And given the time, I'm going to kind of move quickly through some of these early slides so we can focus on those solutions and the ways that we're seeing opportunities come up. As we've named quite a bit of research at the Children in Nature Network. One of the areas that we focus on is building or coalescing that evidence base. There is now over 1,000 research articles that link to the benefits of nature, and that research library can be searched by, the different, are you looking for mental health? Are you looking for cognitive? What are you looking, to hone in on the benefits of health? But as I think of this, really focusing on the children, on the people, right? As we look to conserve lands, how are we centering people? And so thinking of this, back a couple of years ago, we asked children for their versions of what does a just and healthy future look like. And what we received really challenged and inspired us. We're going to come up a couple slides, if you'll advance. Next. And next. One more. Next. So here's a drawing from Maya, age 12, who wrote this to accompany her submission. Everyone deserves the same benefits to happy, healthy life. Nature is a right we should all have. So this is children telling us reinforcing what the research says, right? So we can start to imagine what a just and nature-filled world could look like, right? Let's come to the next slide, and we see that Simran, age 9, wrote that he loves being outdoors and worries about pollution and global warming. That is that eco-anxiety showing up, right? He implores us to imagine a different future. So how can we start to tell a future of a nature-rich environment, one where there's trees and built into our everyday lives, right? As Sherp said, this is not something we get away to, but how do we find it in our everyday experience? To speak to that eco-anxiety that Simran mentions when he says that he worries about pollution, report in 2017 by the American Psychological Association and EcoAmerica that focused on mental health and climate change, named that the human health impacts of climate change give us it helps us understand our physical, mental, and community health, right? That because of this worry that we have compromised physical health can be a source of stress that threatens psychological well-being. That mental health problems can threaten physical health, also inversely, and such as weakening the immune system. And so here, where I'm at in America, they report that over 3/4 of Americans report that they are concerned about climate change. And those who are most alarmed nearly doubled from 2017 to 2021. So now we hear from Dinyanu on the next slide, and she says, but there's hope, right? Children seem to intrinsically understand that nature makes them feel better. So this one, Dinyanu said she loved the trees, the flowers, the birds, and the sky. It was a beautiful place that she had seen. It was a nice day to see, and she said, I love this place so much. This is a calm place for me. So we have the research, and when we ask children, we also get the same answer, right? It's intrinsic in us. On the next slide, author Richard Louv names that the healing the broken bond between our young and nature is in everyone's self-interest, not only because aesthetics or justice demand it, but also because our mental, physical, and spiritual health depend upon it. So as we're looking at this, how do we prioritize not only our lands and our conservation of our lands, but that human experience? On the next slide, our approach at Children in Nature Network, I mentioned the evidence base. So we want to foster the belief grounded in evidence. And then we want to grow the movement. We want to invite others to have conversations about this, to convene folks. And then we also want to focus on systems change. What does that systems change look like? We know that on the next slide, that we're working in now it started at 50 communities, and now we're nearing 70 communities, working in 70 communities across the US. These are communities that have made a commitment to building equitable access to nature in their communities. So this is not going to a faraway place, but how does it show up in their communities? And what these communities start with is an assessment process of figuring out where connection to nature shows up in their communities. They overlay the tree canopy, they overlay parks, waterways, and then they overlay demographics. So socioeconomics, race. And what we see time and time again in cities is that where there is low socioeconomics and more Black and brown people, there is less green, there's less nature, less parks. And then when we look at the quality of those, it is even more diminished and underinvested. So what are we doing? What is happening? We're going to, just in the interest of time, we have a couple of minutes. I want to get to some of the solutions. We're going to come down to the third to the last slide.
Monica, please take your time. I welcome you to finish your presentation fully.
Okay, okay. So one of the ways we're doing this is working with I'll go back to the previous slide in that case. So is working with communities to name and identify. They go through an assessment process. They go through a listening tour, and they make it, and they're scanning their policies to understand what strategies might start to emerge in their communities. And we're going to talk about those strategies in just a minute. We're also partnering with KC Family Programs, which is a child and family services. And on the next slide, you'll see that we ask child and family service providers to name what showed up for them in terms of their priorities. And they named healing, permanency, family, nature connection, safety, and self-regulation. All of these, there is research to back that shows that nature has the power to help each of these outcomes. And the reason, and what we named is what is the opportunity that child and family welfare services, that the children who are experiencing trauma, the research shows they most benefit from the power of nature. That those having adverse childhood experiences can benefit the most. And so that looks like, we're going to go down 2 slides. That looks like what are opportunities to start to explore how we can shift this. We're going to take a look at, first, we've touched on this, integrating nature into the delivery of mental health services. A review of studies in 2020 from multiple countries focused on ways in which the built environment of pediatric healthcare settings can promote the healing and well-being of children. This feature most frequently mentioned is being highly beneficial in child healthcare with gardens and green spaces. Overall results, though, have direct and indirect access to nature can reduce pain and stress, enhance social functioning, and promote an increased sense of control. That's one way that we can go about it. How do we incorporate this into pediatric healthcare? Recommendation number 2 on the next slide, how do we integrate nature into physical and mental health care programming? Our partnership with Casey Family Programs, we're looking at not only the care of the children, but the care of the individuals that are providing the services, right? We have to take care of ourselves before we can take care of others. Then they're looking at ways that they can make access to nature every day. So that includes creating backpacks that they can give to families that have prompts that help them support exploration outdoors. They're also looking at how they support, how they facilitate as child welfare services during their interventions. How can they facilitate and take their interventions outdoors? On the next slide, we also see that a recommendation shows that increased opportunities to interact with plants and animals also improves. This was a study with 5 to 9-year-olds, children in urban junior school context of high socioeconomic exclusion, and it showed increased range of social, emotional, and educational needs, increased empathy, increased cooperation and relaxation when there was exposure to animal and plants. And so now we're going to head into theme 2, which is an approach of increased equitable access to nature everywhere children live, learn, and play, right? And the idea that comes behind that is first, increase vegetation in and around residential settings. A 2003 study by Wells and Evan examined whether vegetation near residential environments might buffer or moderate the impact of stressful life events. What the data showed from 337 rural children in the US was that the impact of life stress was lower among children with high levels of nearby nature. So Sherp was talking about this. Is it dosage? Is it about the amount of it, or is it about the intensity of it, right? And we're seeing that there's a combination there. And then next up, we talk about the opportunity for increased greenness on school grounds. So if we want to think about connection to nature everywhere children live, learn, and play, we need to think about where they are. Children spend a majority of their time at schools. How do we transform these school places into these school grounds into places that for exploration and learning and play, right? So this is one of the approaches that Children in Nature Network, and what we look at is how we create nature-filled multifunctional school grounds that are designed for and by students. That these spaces are also open to the community, and that they increase access to parks and health and well-being. Here in the US, school districts are one of the top 3 landowners across the nation. So when we think about access to land, we may not in our cities, in our urban environments, have an opportunity to acquire new land, but we have an opportunity to use the existing land that is present, and that includes the schoolyards. And then next up, we also want to be creative. So where are places that children are spending time that we may not always think of, but that can be transformed into everyday places for access? So thinking of libraries, we call libraries as nature connectors. We call this nature smart libraries, to provide materials, programming, and leadership for youth to connect at these community hubs, right? They're a free resource. And we're looking at how different agencies can hold and lead this work, right? So what we're seeing in communities is library park partnerships that then bring the park resources and programming to the library to help build their programming. We want to look at early childhood, what's happening in those earliest years from 0 to 5. How can we add natural elements into outdoor environments where young children spend time, and offering nature-based programming as a way to promote everyday connection? Looking at the learning facilities, looking at incorporating nature into these spaces, also delivering nature-based preschool and nature-based programming. So how do we increase professional development for early child care providers? so that they can facilitate experiences outdoor during those early years. We're also seeing cities that are declaring connection to nature as something that is valuable, and by creating a Children's Outdoor Bill of Rights. We call this a COBOR. So it's really it's a statement that serves as both the foundation and aspiration for connection to nature in a city. And it shows up as public facing. It's typically a process that they go through a listening tour to ask children, what is it that is most valuable to you and unique to your community, to declare those, and then to have a messaging tool that elected officials that can get behind, that schools and children can get behind, to serve as a North Star for communities. And so these are, we're also looking at nature exploration areas. So we know that parks are valuable, and the design of the parks matter. So how can we ensure that we're introducing natural elements that inspire movement, that inspire even hiding and play, show up in our park systems? So as we think of this, we're thinking about that it's gonna, on the next slide, that it's gonna take, going back to that original inspiration from our children, that it's gonna take all of our imagination and ingenuity to really realize a nature-filled world and a just-filled world.
Thank you so much, Monica. It's really interesting work, and I think that you draw connections to how multiple institutions in a society can work together for the same objective, to improve this stewardship and connection to nature, and how that is likely very necessary when we're talking about trauma and we're talking about minimal opportunities to purchase new land. Is really interesting. So now we will turn our presentation to questions from our audience. There are a few questions in the Q&A. I'll just point our speakers to those, and feel free to write some written answers as well. I would like to start with one question myself, which is, so Melissa, when we were preparing for this event, you said something quite interesting about how one of the things that you like to do is interrogate nature policies to see how behavior change is being incorporated, because ultimately behavior change is what's going to lead to some of the concrete elements that Monica has been talking about, taking up some of the evidence-based information that Sherp was talking about. So can you tell us a little bit more about this interrogation of nature policies and this behavior change piece, and what that means for stewardship and impact?
Yeah, it's my work that I do with Sarah Golding, who's in attendance here, is I use a behavior change framework called the behavior change wheel, which is a systematic way of identifying determinants of behavior, but behavior change interventions and supporting policies for behavior change interventions, such as education, restriction, changing the environment. And I specifically for things like national biodiversity policies, pollinator policies, they continue to fail. We continue to fail nature. And so I retrospectively use this behavior change framework in these policy actions just to see how well they specify human behavior. Do they mention the most basic thing, like what behavior do they need to change? Who needs to change their behavior, and who's going to be responsible for any intervention? And we've been talking about, with Sherp and Monica, different ways that we can get people to have contact with nature and biodiversity. And so you could interrogate your nation's national policies if they have any, for increasing access to nature or active travel or anything like that, to just, basically see, do they have a specific target behavior? Is it to increase walking and cycling? And then do they specify for whom? And then after that, do they identify any behavior change options available? By doing that, you typically find that even the most basic, whose behavior needs to change, is absent. We found that in pollinator policies in Europe, that for only 40% of the actions actually mentioned who needed to change their behavior, which just basically says, it's not surprising these biodiversity policies fail. And if we see the same in health, then it's also just going to suggest that they'll fail. So it just provides opportunities for greater specificity. So whose behavior needs to change and what do they need to do? So if we want to, get more children to access parks, then we need to be specific about that and then think about what interventions are needed.
Thank you so much. We have some really interesting questions in our Q&A at the bottom of the screen. There is a little tab that says Q&A. I would like to read these out loud, then I will let our speakers think and hand over to Siti to coordinate additional questions. This one is for Sherp. Is mental health being incorporated in discussions around smart cities development? Monica, are there ways you are currently tracking the impacts and longer-term outcomes to children in communities where the greening of schoolyards are being implemented? And there's a question about, are there resources for young people struggling with eco-anxiety? And then another question on nature disparities in terms of equitable access across socioeconomic levels and how they compare between the global north and global south. So if our panelists can think through those questions, Siti, I hand over to you. You have some questions prepared and also to lead part of the session.
Thank you, Liz. Yes, I do have prepared some questions for the panelists. With regards to discussion by Melissa and Associates is basically on the connection and also between the nature and also the mental health. So how about, is there any evidence to say that this climate change and environmental disasters is one of the cause of mental health? So that, for example, can we diagnose someone who is having mental health illness? It is triggered by the climate change or environmental disasters. And how do you want to differentiate the cause that triggered by the environmental disasters and climate change and the real cause? So as for now, there is no one specific definitions or one definite diagnosis that climate change is one of the cause of mental illness. So what do you think about this? And another question, perhaps on eco-anxiety as well, Monica. If we look at the current trends now, the climate litigation is actually now brought by the youth, the children, because they are so worried, so anxious, as you mentioned just now, about what happens surrounding them. And they are also blaming not only that, they are pointing a fingers to the government for not doing something to avoid the harm. So what do you think about these trends? How to balance actually between the economic development and also the biodiversity protections?
So let's start with the first question on climate change, the connections between the evidence and climate change. Melissa and Sherp, did you have any comments from that academic side? And then Monica will go to you if this is a piece of the work of your network.
Yes, well, it's not my field of expertise. I have not done research on it, but obviously disasters such like floods have a huge impact on the people that suffer from them, especially if there's a chance and it can happen again. And in some cases, it has happened again. And in many ways that affects their mental health in a negative way, to having to deal with that. But you had a more complicated question about the real cause. It's our own behavior. in part that is responsible for the climate change. Is that what you meant?
Yes, whether climate change can be categorized as the cause of mental illness.
As a cause, yeah, in some cases it can, if it leads to disasters. Also, the issue of heat stress, of course. That's also a very important one. And I might add that I think at the moment, in the Dutch situation, there's more talk of more work going on nature-based solutions for climate change adaptation than to either improve biodiversity or to improve health. So nature-based solutions for climate change adaptation focus on climate change adaptation, and they don't always look also at the benefits for improving, possible benefits for improving biodiversity and for improving health, mental and physical health as well. And that's a pity, because something's going on, and sometimes with a little more extra effort, it could have also a much larger impact on the biodiversity and or the health of people.
But how do you want to actually determine whether this cause, the climate change disaster or whatever environmental disaster, is actually the main cause? Because perhaps they have the pre-existing conditions, they have other factors.
Yeah, it's a very difficult one to research on, because usually you would like to meet before and after, but yeah, it's not common when you know a flood is coming to quickly go out and ask people how are you feeling at the moment, because then they already know the flood is coming and already
Thank you, Siti, for
affects their well-being. So it's difficult to perhaps to prove by normal scientific methods, but I think it's obvious nevertheless. So yeah.
Okay.
Thank you for bringing
thank
up
you,
the
Jeps.
issue
Okay.
of attribution, Siti. It's extremely complicated to then attribute a certain phenomenon to a certain mental health state, and it's an area that's quite difficult. Monica, did you have any connection to the climate change space in the work that you're doing? I can understand if it's beyond the scope of the implementation space, but curious, based on Siti's interest, if you did have that built into the programming.
We don't have that specifically built into the program. Siti, what comes to mind for me is that we're working with a group called AutoCase to look at the opposite of what is the return on investment for when we transform green spaces and we transform schoolyards into green schoolyards. So we're looking at not so much the effects of climate change, but like what are, I think for us, centering the human experience around that. And so what's the long-term return on investments? Oftentimes we hear like, you know, there's a upfront cost, financial cost to transforming spaces in, you know, to reimagining our spaces. And so we're looking at what is the financial cost of that long-term, and how does it pay off? And two, what is the cost in terms of, it's hard to put a price tag to this, but what is the cost to not do it, right? So in terms of the mental health and the physical health of children, and so, but not specific to climate change.
Well, I think that's
Thank you.
nature-based solutions for public health is a growing domain, and how do we connect some of these aspects very much beyond the scope of much of the presentations today, but resilience in a schoolyard or a city to climate change is related to our ecosystems and the buffering capacity we have for heat islands, for example. I'm sure greening schoolyards across the city of New York would be tremendously valuable for bringing down temperatures in the city, as an example. But we do have just a few minutes left, and we have questions from the audience. So just wanted to return to those. And since we are talking about cities, Sherp, could you take the question that was addressed to you about mental health? It was in the Q&A, being incorporated into discussions on smart cities and development. Is it to your knowledge being incorporated? And if not, maybe what is a barrier? And if you could give maybe a minute or so to your response.
I can try. Once again, it's not my expertise, smart cities, but what I know from it, I must say, I'm pretty familiar with the nature and health research and mental health, and I don't come across the concept of smart cities in that domain. I'm afraid that the reverse is true also, and I think the focus of smart cities is not as much on mental health as such. Maybe it's on partly on personalized medicine, making things that way smarter, digitization, etc. But
Important gap then,
no,
perhaps.
I think also smart cities. I think the focus is not very strongly on increasing the biodiversity of cities. It's more about technological solutions, is my impression.
Another question that was raised, and this question was raised by Shima Hai, and specifically on Global North, Global South. I'm going to put this to Monica first, because Monica, I know that a lot of the work that you're doing is focused on disparities. And the question is, in terms of equitable access across socioeconomic levels, are they similar Global North, Global South? Is your organization addressing these, or do you know of other organizations who might be doing this? What would be first steps in this?
Yep, I would say that the primary focus of our work is across the U.S. So looking at the disparities that exist there with race and demographics and access to the outdoors, and the trends that we're seeing, which are consistent, that there's been underinvestment in terms of development of green space in those low socioeconomic communities. But in terms of looking at other countries, one of the things we have done, and I'll drop a link here, is it's not as specific to disparities, but documenting ran a global study on green schoolyards to document case studies from around the world of places that are transforming schools into community hubs. And so we have individual case studies, but not necessarily data across those sites.
Sherp, I'm wondering from the research angle, how this might be.
Well, the most research is conducted in high-income countries and focused on cities especially, but research on green space and health is coming now also from the global south or lower middle income countries. I'm just looking now at a recent systematic review about access to urban green spaces in cities of the global south. So there's already something out there.
Well, welcome you to paste that in the chat if you like.
I can try to find the right reference and paste it in the chat, yes.
There is another question from the audience from Corinne Grant, and she is asking, I'm going to point this to you, Melissa, what resources would you recommend for young people struggling with eco-anxiety? And she says resources for young people or conservationists. And are there resources? What might you recommend? What's a go-to space or organization who might be looking at this?
Good question, especially because we know that young people do have increased, or there's a greater prevalence of eco-anxiety among young people. That could be also related to the fact that they have this fear, but they lack agency to do anything. And conservationists is really interesting, Karine. There was a recent study in eco-anxiety that was highlighting these eco-psychology, highlighting that people who work on the front line of biodiversity loss and nature conservationists do have this pronounced feeling of loss and grief, and that needs to be acknowledged a little bit more. So what to recommend for people who experience eco-anxiety? The coping strategies typically are similar to those if you have anxiety. They're emotional focused coping, so interventions to increase one's psychological resilience, to cope with the emotions of eco-anxiety. There's also problem-focused coping, so how we can encourage people to take action or join established groups or organizations for action or for social connection, where they can feel that these feelings that they are experiencing, they're not abnormal. They themselves, are part of other people who similarly feel this way. And interestingly enough, connecting to nature is an intervention to treat eco-anxiety, which further highlights both the importance of the beneficial psychological benefits of contact with nature, but also is, to me, one of the consequences of climate change is that climate change and biodiversity loss are interlinked. And in addition to the effects of climate change as flooding, we're going to experience our natural environments are going to significantly change. And will those changes mean that the environment is less able to restore us psychologically and benefit our mental health and well-being? So I would recommend that perhaps if one is able to have contact with nature.
Thanks, Melissa. And definitely this is a big gap space. A lot of us out here are trying to understand the term eco-anxiety and what this means, in addition to trying to find ways to address it and handle it. And that's on top of the mountain of other issues that clinicians deal with in terms of mental health and the various diseases that come with that. There is one final question in the Q&A from the audience. Oh,
Liz,
yes, Monica, please.
Liz, we expand on that really quick.
Yes.
Yeah, I just want to put 100% mark on what Melissa just named. One of the slides that I moved pretty quickly across was that, the quiet, we call it the quiet crisis, right? The children are spending 90% of their time indoors and 50 plus hours a week on the screen. And so when we hear of conservation and environmentalists, and myself having a teenager, in that they're receiving this news via media, right? And it is prompting, and certainly following, the real climate change that's happening every day and affecting our communities. And they're feeling and seeing that news. And so previously, our environmental ethos was most commonly tracked by our desire to care for the world, and conservation was tracked by our experience outdoors. Our experience outdoors helped to build an environmental ethos. And now some of that environmental ethos that is coming from young conservationists and environmentalists is driven by the news versus their direct experience. And so so how do we bring them back to the source of the care they have, right? To, as Melissa said, to experiencing the benefits and to complement or to counter the stress that they're experiencing by hearing the news. And so I just wanted to, Melissa, I just couldn't agree more. We're seeing that, and I see it in my own teenager, that they're taking in all this news and worried about the environment, but not actually getting to experience the benefits of it in their day-to-day life.
It's incredibly interesting and powerful words, the quiet crisis. I think that's a really important way to put that into 2 words. We have just 1 minute left. We had a question, Monica, on impacts of the work that you're doing, if there's any tracking. If you could give a 30-second response on that, and then we'll quickly close out this to be on time.
Yeah, I dropped in the chat a link to our global studies, green global studies tracking of outdoor learning across the world, and that tracks quite a few case studies that exist, but not necessarily outcomes across sites. So we have individual case studies to look at.
Fantastic. Well, we are at time. This has been an extremely interesting webinar. I have learned a lot. There are several resources I am going to follow up on myself, and I encourage all of you to look into the work of our experts and the fields that they represent. This session will be available as a recording on the IUCN Commission on Ecosystem Management webpage. I'm not sure exactly when, but it will be available so that you can review this. If you are in the audience and did want to get a IUCN certificate as was advertised, please send an email to iucn.cem.hh@gmail.com. And lastly, this is just one piece of a very large puzzle. There are many different perspectives on how we connect to nature, on how mental health and emotions and spirituality connect to nature. There are parallel conversations that need to be explored. And I did just want to make sure to highlight that there is a tremendous amount of work under the Indigenous scholarship on this issue. As we know, this innate interconnection with our natural environment has gone back into time immemorial with Indigenous peoples worldwide. And we did not reflect those perspectives here today, but hopefully in a future session, we will be able to build in additional perspectives such as that one. Thank you so much for attending this. Thank you to our team at IUCN, and we welcome you to follow up on our recording. Thank you.
Thank you, Liz. Thank you, everyone.